Thank you. My name is Jennifer Brower, and I'm honored today to represent our team, the Inner City Health and Wellness Program. The logo you see here on the first slide is for our clinical team, our Addiction Recovery Community Health, our ARCH team. If you asked me 2 years ago, when I started in this program, what this logo meant to me, I would have told you and explained it to you from a provider's perspective. I would have said it's an open door. It's removing barriers and creating easy access for our patients. My perception of this logo has changed significantly throughout the 2 years that I've been with this program. Working with a passionate and dedicated team alongside amazing and resilient patients, I would now tell you this logo represents patients opening their door to us. Breaking down barriers, building relationships, and always keeping the patient at the center of what we do has created an environment that we all feel privileged to work in every day. This is a picture outside of our emergency department at the Royal Alex. We are an inner city hospital located in the heart of Edmonton's inner city. If you ever came to the Royal Alex, you might see a scenario like this quite often. We serve a high number of Edmonton's most vulnerable patients, many with untreated substance use disorders, medical and psychiatric illnesses, and substantial social inequities. Many of the patients who were accessing our hospital were being treated for their medical concerns, but were often being discharged without addressing any contributing factors such as homelessness and poverty. Patients that were admitted to our hospital often were unsuccessful with completing their course of treatment or remaining in hospital for a variety of reasons, but mostly because our rigid system did not allow for them to practice things like harm reduction, and it also did not allow them to really be active participants in their care. So understanding the challenges and recognizing the need for change, and with incredible support from our Royal Alexandra Hospital Foundation, the Inner City Health and Wellness Program was established in 2014. So there were many contributing factors and pieces that helped get our program up and running. We conducted a large survey of patients who had accessed our emergency department for acute chronic substance use and or were unstably housed to get feedback from them, We liaised with many of our community partners and agencies that we often were trying to connect patients to on discharge, sometimes successfully, sometimes unsuccessfully. So we spent a lot of time trying to see how we could build those relationships. And most importantly was consultation from our community advisory group. This is a picture of our community advisory group the day of our official launch at our hospital. The quote underneath the picture you see, "Nothing about us without us," is a quote that you might hear in many different service settings. But for us, it was really important to keep this at the center of what we did. We wanted to build a team and build services and programs within our hospital that our patients would use and that they had input into. So this group contributed to a half-day planning session where we spent a lot of time talking about what needed to be improved at our hospital. Some of the key themes that came through were the increased need for communication, a more holistic approach to what we were doing, and always using best practices for addiction medicine in our hospital. There was also quite a large emphasis on the ongoing need for our community advisory group engagement, and to this day we still meet quarterly and involve them in all of the things that we do. So our solution, our program, the Inner City Health and Wellness Program, has 3 key arms to it. The first is the clinical consult team, or the ARCH team, which I've already spoke about a little bit. This is a multidisciplinary team in our hospital designed to provide a full complement of support to our patients who are admitted. We have physicians, we have nurse practitioners, addiction counselors, social workers, nurses, and peer support workers. Our peer support workers all have lived experience and often come from a background that relates very much to our patients. And they have been instrumental in helping us to establish credibility with our patient population and breaking down that first barrier of learning to trust. Our research program is quite robust and focuses on many aspects and outcomes of our program. We often make changes and adjust our services in response to patient feedback, mostly obtained through our research team. Finally, we have an education arm where the primary focus of this group is really to work on changing the hearts and minds of our staff through knowledge and support. Culture change was a huge aspect of our work and something we continue to work towards every day. All of our work and services provided is informed by our community advisory group. We don't implement anything without their input. I have many examples of where they have certainly steered us in a clearer direction than I think we maybe were going to start with. Some of those include our managed alcohol program, our immunization program, and our supervised consumption service. In 2016, we did receive permanent funding from Alberta Health Services, which was quite a huge accomplishment, I think, for a grant-funded program. In our first 2 years, we've served over 1,700 unique patients, and that number continues to grow. As our program expands, we are looking to move into the emergency department so we can provide quicker access to those patients in need. We currently still are not able to see a large number of those who access our site. I think one of the most valuable and influential evaluative measurements are all the quotes that we've gotten from our patients through our patient outcome evaluation. This one here I really struck with me. So the quote says, they treated me like more than just a number. They treated me like I was a member of their family, a little brother or somebody they actually cared about, which was big. ARCH is the first organization I've dealt with that I felt that kind of care and commitment from. I think that really, quotes like that and patients like this patient are what really help us to continue to move forward sometimes when there are challenges that we may see. In the past year, we have received further funding from the Minister's Opioid Emergency Response Commission to expand our program. In September this year, we will be embedding a second ARCH team in the emergency department at the Royal Alex Hospital so we can have quicker access for our most vulnerable patients. There will also be an ARCH-like service implemented at the PLC in Calgary. I think for myself as a manager, one of the ways that I know we've really done great work is the requests that I get both throughout the province and also throughout the country for information on how we've managed to implement a team like this in an acute care setting. It's been, I think that really speaks to the novelty and the patient-centeredness of our program. Recognized barriers to spreading this work include the need for increased training for all healthcare providers, including physicians in addiction medicine. A large part of our work at the beginning and still is to advocate for better training for patients with substance use disorders so we can care for them appropriately. This program, I think, although you would consider it highly cost effective, raising initial funds to implement similar programs I think would be a bit of a challenge. This is not something that you could do off the side of your desk. This takes a dedicated team and that works very hard to meet the patients where they are in the hospital and try to improve outcomes as best we can. Finally, and I think perhaps the biggest barrier to spread is changing culture, changing perspectives, and embracing a more patient-centered approach for our most vulnerable patients that we see. This is an ongoing advocacy that we do, and I think we are making big headway, but lots of work to do still.